For the sheets, I have the provider orders, the MAR, and then my one-pagers. Hi, I'm Maddie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Jenna Wolf, 9/11/04.
Perfect. I'm looking for need hygiene. And I'm going to provide privacy. Do you have any allergies?
Sulfa and betadine.
Okay. And I don't need to wear gloves and PPE for this. Today, I'm just going to be getting your medications and giving you them. Are you in any pain today?
No.
Okay. And can you take medication orally by mouth?
Yes.
Okay. Perfect. Are you in a comfortable position?
Yep.
Okay. I'm gonna go get your stuff and I'll be right back.
Okay.
Alright. So the digoxin level is 2.1, so I will be giving that, and I will be giving Lasix and warfarin. The nursing considerations for digoxin are assess and document apical pulse for a minute before giving product, monitor electrolytes, monitor ECG, and beers avoid dosage greater than 0.125 milligrams. For Lasix, the nursing considerations are assess fluid volume status, monitor electrolytes, monitor for skin rash and Stevens-Johnson syndrome. And for warfarin, the nursing considerations are monitor blood pressure, assess for fever, skin rash, and risk for injury. And for the lab, digoxin's level of toxic is 2.4, and Joseph Smith's digoxin level is 2.1, so I will be giving it today. I'm going to look through my provider orders and my MAR. So we have digoxin, 0.125 milligrams by mouth for Joseph Smith. That is for CHF and atrial fib, and that's daily. And then we have Lasix, 40 milligrams by mouth for Joseph Smith, twice daily for CHF, and that's by mouth. And then warfarin, we have 5 milligrams by mouth daily for atrial fib again. Alright, I'm going to put my provided orders away. And I'm going to start my first med check. So we're going to start with digoxin. So I have digoxin here, 0.125 milligrams by mouth. This tablet's 0.25 milligrams, so I will split it in half to get 0.125 milligrams. This is for Joseph Smith, and it's used for CHF and atrial fib. The expiration date is 04/2041, so it's good, and the package is intact and good. And now we have Lasix. I have Lasix, 40 milligrams by mouth. I have two 20 milligram tablets, so that's 40 milligrams. I have this for CHF for Joseph Smith. This is by mouth, and the expiration date is 04/2041 and 04/2041 for both, and both packages are intact and good. And lastly, I have warfarin. So for this, I have warfarin for Joseph Smith, 5 milligrams by mouth. This is for atrial fib, and the expiration date is 12/31/2034, and the package is intact and closed. Gonna do my second med check now. So we're gonna start with Lasix. So I have Lasix for Joseph Smith. I have two 20 milligram tablets, which is 40 milligrams by mouth, and that's what he's prescribed. for CHF. I have the expiration date to be 4/2041 and 4/2041 for both. The packages are both closed and intact, and there is no need to split or crush either of these medications. For digoxin, I have digoxin here for Joseph Smith. I have 0.125 milligrams by mouth. This tablet is 0.25 milligrams. So I'm going to split the medication in half. So I have 0.125. And this is for CHF, and the expiration date is 04/2041, so it's good, and the package is closed and intact. And lastly, I have warfarin for Joseph Smith, 5 milligrams by mouth for atrial fib. That's daily. And the expiration date is 12/31/2034. And the package is good, and there's no need to split or crush. And then for all three, digoxin, Lasix, and warfarin, the time is between 7 and 3, and it has not been given yet today, either of the three medications, so I will be giving all three. Alright. Now I'm gonna get ready to do my third med check at bedside. Hi, I'm Maddie. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Jenna Wolf, 9/11/04.
Perfect. And I'm going to perform hand hygiene. Do you have any allergies?
Sulfa and betadine.
Okay. Good. I don't need to wear gloves or PPE for this assessment. Today I have your medications here. I'm going to just go through a med check quick to make sure it's all correct. And we're going to talk about the medications a little bit, and then I will give you them. Okay? Is that okay?
Yep.
And again, are you in any pain?
Nope.
Okay, and you can take medication orally, correct? Okay. Perfect. I'm going to scan your wristband. Good. And now I'm going to start my med check. Alright, so I have warfarin, 5 milligrams by mouth for Joseph Smith for atrial fib. The time is between 7 and 3. And he hasn't gotten it yet, so I will be giving that now. And then I'm gonna scan it, and again, warfarin 5 milligrams. Now I have digoxin, 0.125 milligrams by mouth for Joseph Smith. This is for CHF and atrial fib. The time is between 7 and 3, and he has not gotten it yet today, so I will be giving that. And that's by mouth. And I'm gonna scan it. And that's digoxin in 0.125 milligrams. And the last medication I have is Lasix. I have 40 milligrams by mouth, twice daily for CHF. The time is between 7 and 3. And Joseph Smith, it's 4, but he has not gotten it yet for his first dose for the day. So I will be giving that. I have 2 tablets of 20 milligrams each, so I'll scan it. That's 20 milligrams. It's 20 milligrams of Lasix, which is 40, which is what I will be giving. Alright, and do you have any concerns before we begin? Okay, I'm just going to go through and tell you the action of these medications and then the side effects, and I'm just going to have you teach me back that, okay? So first I have digoxin, and that is used for atrial fibrillation and CHF, and some of the side effects are headache, drowsiness, confusion, hypotension, anorexia, vomiting. Can you tell me what digoxin is used for?
Atrial fib and CHF.
Perfect. And can you tell me a side effect?
Headaches.
Perfect. All right, now we have Lasix. Lasix used for CHF, and some of the side effects are circulatory collapse, renal failure, Stevens-Johnson syndrome. Can you teach me back what this is used for?
CHF.
Perfect. And can you tell me a side effect?
Renal Johnson syndrome.
Stevens.
Steven Johnson system. Sorry.
No, you're good. All right, and then we have warfarin. This is used for atrial fib, and some of the side effects are nausea and cramps. Some of the more serious side effects are hematuria and hemorrhage. Can you tell me the use for warfarin?
Atrial fib.
Good. And can you tell me a side effect?
Hemorrhage.
Good, thank you. All right, and are you sure you don't have any concerns, any questions before we begin?
Mm-hmm.
And you're good with taking all your medications today?
Yep.
Okay. So I'm gonna give you this with some water. I'm gonna make sure you take all of it and this it all down.
Yep.
Okay. Perfect. Do you need some more water?
Nope.
Okay. So I just held your pain medications today because you weren't in any pain, but I was able to give digoxin, Lasix, and warfarin. I will go tell any concerns I have per agency policy, and I'm going to document my medication administration. Alright, now that's charted. I'm going to come back and reassess you in 30 minutes to make sure everything is okay. If you were having adverse side effects, I would contact the prescriber, contact the pharmacy, do your vital signs, document per agency policy, and okay, let me say that one more time. Okay, I will reassess your vitals. I will withhold any further doses and contact the prescriber, the pharmacy, and then I would document per agency policy. Do you need anything else before I go?
Nope.
Okay. I'm going to cleanse my equipment to get that ready to go. I'm going to perform hand hygiene. And the 5 moments of hand hygiene are before touching a patient, after touching a patient, when coming in contact with bodily fluids, before a procedure, and when touching a patient's belongings. Going to make sure your side rails are secured, your collet is in reach, your bed is low and locked, and your room is risk-free of falls, and your side table is close and good. Are you in a comfortable position?
Yep.
Okay. Thank you very much.